Go ahead and we're going to be talking about breast cancer. It's actually a new kit that you can actually swab the inside part of your mouth. It's a kit for an estrogen gene test, actually, and it helps detect early breast cancer. And this is Stacia, and Stacia, your last name?
Stacia Hachem.
Hachem, that is. A breast cancer survivor and founder of the company that created the Estrogen Gene Test, and Dr. Donese Worden. Thank you for coming in, both of you ladies.
Thank you.
So tell me about this test while I'm swabbing and what it actually can share with us once we get the test back.
Well, 1 in 8 women will develop breast cancer in the United States in their lifetime. And 80% of them are going to have absolutely no genetic risk factors. 50% of them are going to have absolutely no known risk factors for breast cancer whatsoever. So what this test allows us to do is look at women who have no indication whatsoever and help them figure out if they can take hormones, to help them plan their fertility life schedule, and most importantly, what they can do to mitigate their risk and improve their estrogen health.
No, it's 30 seconds, I think you said, right?
Yep, 30 seconds. We put it back in here. We let it dry. And
So
we'll let it dry, and we put it back in here, and it gets mailed to the lab. And then it gets reviewed with your doctor, such as Donese Worden or one of our physicians.
Now, you're actually a breast cancer survivor.
I am.
Can you share kind of your story and why this is something that was, important for you to do?
You know, it was very important for me to get this message out to women because I have absolutely no breast cancer history in my family. None. None whatsoever, going back generations. No known risk factors. And so when I wound up with breast cancer and I found out that in fact what we have in our family is a estrogen metabolism dysfunction,
right.
It was very important for me to get this word out to as many women as possible. So that they could take this test as well and do something about their risks before they develop breast cancer.
And Dr. Worden, you're here in the Valley.
Yes, I am.
2 practices, Scottsdale and Mesa, you said. And you use this in your practice, right?
I do. We're always, as physicians, looking for anything that can help prevent. The more information we have, the more individualized medicine that we can do with our patients.
Okay.
When I utilize this test, it's not just letting me know risk factors. It's letting me know what lifestyle changes, what medications and or nutritional supplements could help prevent the breast cancers. So it's not just saying, oh, you've got 3 SNPs, genetic problems here, nothing to do about it, I hope you don't worry. No, no, no. With this information, we can look at how do we treat and prevent, mostly prevent.
So the information that you get back from this test, what is it? Is it like a report that you get or just a letter? Or?
It's a report, and it lets us know those mutations. They're called SNPs, little pieces, and if you've got 3 or more, you've got a fairly high risk of breast cancer, prostate, colon. It's not just breast.
Okay.
But it really lets us look at you as an individual. We all have similar DNA, but our individual DNAs and our damaged DNA is the most important thing to look at. And this metabolism, if you don't metabolize your estrogen properly, you're at risk.
Is it covered by insurance?
No.
No. And what's the cost of that?
Of the individual test?
Right, if somebody wanted to get an individual test.
The test varies state by state, but in principle, the test cost is $725.
Yeah.
And it's not covered by insurance.
And not covered by insurance. Then how long does it take for you to get the results back?
Anywhere from 6 to 8 weeks, conservatively.
Yeah. Because it goes to a genetic lab, a premier genetic lab that's really looking at your DNA, so it takes a while to get it back.
Yeah, interesting. Stacia, thank you so much for sharing this, and Dr. Worden, appreciate you coming in to give us insight about it.
Thank you for
especially because you didn't have actually any breast cancer in your family history. It was really important for you.
And 80% don't. That's important for all of us to know. 80% of breast cancers are not being seen by family history.
Wow.
And I think also 25% of all breast cancer survivors are going to have a recurrence. So the individual treatment that this test prescribes can help with that recurrence risk as well, which is why I consider it to be something that may be saving my life.
And is hormone therapy safe or not? That's a very important question.
Oh, thank you. Appreciate you guys coming in.